Okay, part one of the mechanics of breathing is going to deal with pulmonary ventilation and how that relates to Boyles Law. So pulmonary ventilation, as we've learned from that previous video, is where we exchange the atmospheric air and how that gets into your lungs and then how you exhale into the atmosphere. Okay, so this is pulmonary ventilation. And pulmonary ventilation is going to be dictated by Boyles Law, B-O-Y-L-E-S. So we'll go look at that a little bit more in detail. And then once we look at that, then we'll focus in on the skeletal muscles associated with breathing and how those things apply, or how those muscles apply. And then we'll look a little bit further into what quiet breathing is, what forced inspiration is, and what forced expiration is. So let's look at this video real quick. It's all about 30 seconds to a minute, and then we'll go from there.
Pulmonary ventilation, or breathing, is induced by changes in the volume of the lungs and the air pressure within them. During normal inhalation, the diaphragm and external intercostal muscles contract and the rib cage elevates. As the volume of the lungs increases, air pressure in the lungs drops below atmospheric pressure and air rushes in. During normal exhalation, the muscles relax, the lungs become smaller, pressure inside them rises, and air is expelled. Boyles' law explains this relationship between volume and air pressure. An increase in the volume of a container lowers the pressure of the air inside. A decrease in the volume raises pressure in the reduced space. The body's demand for more oxygen can change normal breathing to forced breathing. Additional muscles increase the changes in volume of the thoracic cavity so that more air can pass in and out more rapidly.
Okay, let's look at Boyles' Law a little bit closer here. And Boyles' Law basically says that as your pressure increases, the volume decreases. Okay, so what's this mean? So if I have a container, a syringe. Okay, well, I tell you what, let's go look at a picture here that's of a syringe. Okay, so on this picture, here we have our standard syringe on the right, and you're going to have a substance that's within the syringe. Let's just say we don't have anything in it and it's just air. Okay, so if we were to block off this area so we don't have air or liquid or anything else getting in or coming out of that syringe. So like here, we're blocking it off, okay? And if we were to depress this plunger and it's going down and this is coming down, can you see how whatever's in this area is under greater pressure? And likewise, if we were to pull the plunger out, we are increasing the volume, but when we increase that volume, we decrease that pressure. So this is what's happening within your thoracic cage. When your thoracic cage gets larger, the pressure inside your lungs decreases. Okay, this is really important because this is going to lead into part two. So as you inhale, or when we're taking a breath, your thoracic cage gets larger. When your thoracic cage gets larger, the volume in your thoracic cavity gets larger. And when the volume gets larger, the pressure decreases. When you exhale, your thoracic cage shrinks in, gets smaller, so your volume is decreasing, but the pressure is then increasing. So let's go through this one more time. Inhaling, you have an increase in thoracic cavity size. When you increase the volume, the increase of thoracic cavity size, the volume decreases. The pressure decreases. So increase in volume, decrease in pressure. When you exhale, you decrease volume, you increase the pressure. Okay, so that's going to be an important thing to understand on why or how we inhale and exhale. Now, the next thing that we're going to look at is what's causing those changes. Okay, what is changing the volume of your thoracic cavity, either by making it bigger or more or less. Okay, so that's going to be the next thing. Okay, there's 3 different type of breathing patterns that we want to look at and how those relate to changing your thoracic cavity volume. Now, the 3 breathing types that we're going to be looking at is going to be quiet breathing, then there's going to be forced inspiration and forced expiration. So all of those deal with changing your volume of your thoracic cavity. Okay, so inspiration, whether it's quiet or forced, is going to be increasing the volume, which then therefore decreases the pressure, or exhalation, which decreases the volume, which increases the pressure. So let's look at the muscles associated with inspiration. And specifically, let's first look at the muscles associated with quiet breathing. Okay, so quiet breathing is the breathing pattern that you would have when you're just sitting on the couch watching TV, okay, or you're sleeping. Just everyday breathing that you're not paying any attention to. We don't have a huge change in the volume of your thoracic cavity. The diaphragm's moving very little. But the muscles that are involved with quiet breathing are going to be the diaphragm, and this is going to be your primary muscle of breathing, and it's a dome-shaped muscle that when that muscle contracts, it goes down. Okay, so if the diaphragm's here and we contract it, it's going down. And when we're changing this, we're actually increasing the vertical space of your thoracic cavity. We're elongating it, okay? When we elongate this, that's going to increase the volume, decrease the pressure. Another muscle that's associated with quiet breathing are your external intercostal muscles. Now, those muscles, if you can see here, okay, those muscles aim to pull the ribs up and out, okay? So as we're pulling up and out, that's increasing the lateral dimensions of your thoracic cavity and your anterior posterior, okay? So when you're sitting there, take a deep breath. And I want you to pay attention to, first off, what the diaphragm is doing. The diaphragm, when you take a deep breath, is going down, okay? So you're increasing the vertical position of your thoracic cavity. And then put your hands kind of here so you're going to feeling the ribs and take a deep breath. You're going to feel that the ribs are kind of coming up and out. So we're increasing the A to P, anterior to posterior dimension, as well as medial to lateral. So we're increasing the lateral dimension. So any way you look at it, your vertical, A to P, and lateral dimensions are increasing in dimensions, and therefore it increases or allows for inspiration. Now that's quiet breathing. Forced inspiration is if I tell you to now, okay, I want you to take a deep breath, okay? This can be associated with coughing, okay? So that's going to be expiration. But forced inspiration, if I tell you to take a deep breath, you have to incorporate accessory muscles. So other muscles besides the diaphragm and the external intercostals have to come into play. Those muscles are going to be your sternocleidomastoid, okay? As you can see, if this muscle contracts, it's going to pull your thoracic cage superiorly. This is going to increase the vertical dimensions, okay, which is going to assist the diaphragm. You're also looking at some scalene muscles. This is a muscle we did not learn in the muscular system, but those are the scalene muscles, and you can see where they're inserting into your upper ribs. If these muscles contract, they shorten, and can you see how they're also pulling the ribs superiorly? When that happens, you are increasing the thoracic volume. Your pec minor, if this muscle contracts, it's pulling your ribs kind of in this direction. So you've got more of an A to P dimension and going a little bit lateral. So that's increasing the volume. And then the serratus anterior also does a little bit. It's pulling the ribs out as well, more of a lateral dimension. So that's going to be forced inspiration. And I think the next one is going to be forced expiration. Okay, so the diaphragm is associated with inspiration and expiration. So if the diaphragm is this domed muscle like this, contraction, it goes down, which then increases the vertical dimensions of your thoracic cavity. When that muscle relaxes, okay, it goes from the depressed area and it rises back up. When it rises back up, it's compressing your thoracic cavity, increasing the pressure inside your lungs, okay? The additional muscles that's going to be associated with forced expiration would then include your internal intercostal muscles versus external. So external is going to be inspiration. The internal intercostals are going to be for expiration. Okay, so that's going to be forced exhaling on this one. So when you contract those muscles, it's pulling the rib cages back down, making your thoracic cavity smaller. We're going to have the transverse thoracic muscles up in here, another muscle we did not learn. It does the same thing. And abdominal muscles. Now this is an interesting portion of here, is your abdominal muscles really isn't directly associated with the rib cage. What it's doing, okay, when you're sitting there, exhale. Put your hands on your abdomen and take an exhale pretty forcefully. Feel your abdominal muscles, okay? You can feel those muscles contracting. And when those muscles contract, it squeezes your abdominal cavity. And when it squeezes your abdominal cavity, it's pushing all your guts on the underside of the diaphragm, and it's pushing them up into your thoracic cavity, which then, when you're bringing the diaphragm back up, that's causing a decrease in volume, increasing in pressure, leads into exhalation. So those are your differences, or those are your skeletal muscles associated with quiet breathing. Know those. Know your primary muscles that we've done for forced inhalation and exhalation. Know those as well. Know Boyles Law, what the basics is of that. So part 2 of this video, what we will look at is we're going to look at actual pressure values, okay? At sea level value, what pressures in your lungs, what pressures in your intrapleural cavity, all of that. And then once we put it into a mathematical formula, you'll see how those pressures change and what the results will be. So stay tuned.